Hi there. Today we're going to talk about vaginal exams in pregnancy. We're going to try to break down why people maybe have vaginal exams before going into labor and what the purpose is of this.
So a lot of people in standard care will be offered a vaginal exam during the course of their pregnancy, particularly in third trimester. So what that means is that the provider will insert their fingers vaginally to feel whether the cervix is dilating or whether the cervix has made any change. They'll also feel for things like fetal station, which tells you how low the baby is in the pelvis. And this is offered as a way of sort of assessing what's been going on and is given as an option to people to kind of check in about whether they've made change. In our experience, it's somewhat misleading to do this because when you do a vaginal exam, you're definitely seeing what's already happened, but you're not seeing what's going to happen. So doing routine vaginal exams weekly in the end of pregnancy might not give you the encouraging news that you're looking for, and it also is not a good predictor of when you're actually going to go into labor. And since most cervical change happens in labor, it might not give you information that is what you're really wanting, which is when am I going to have my baby?
Yeah, and it's really challenging, like Sarah said, to have cervical change without being in labor. So if you're not contracting, if you're not having contractions on a regular basis, receiving an exam isn't going to really give any information about whether or not you're going to have a long labor, a short labor, if you're going to go into labor tonight or next week. It doesn't really give us any information other than what has already happened.
Sometimes people will offer vaginal exams to clients who are contracting to see whether any cervical change has happened. So in the case of preterm labor, or in the case of what's called prodromal labor, where somebody is having regular contractions but they don't know if it's creating change, it might be important for you to find out if you are having cervical change if you're not yet term, or if there's some other complication that you want to figure out with your care provider. So in our experience, we really recommend that people have vaginal exams if it's going to change either their decision making or the management recommendations from the care provider. And if those things aren't true, then it might satisfy curiosity, and that might be reason enough for somebody to want a vaginal exam, but it doesn't necessarily necessitate a vaginal exam.